Also, heaps of garbage have taken over the Tamale Teaching Hospital after 3 days of the ongoing strike by the Health Service Workers Union. The various wards are unkempt, washrooms stinking with urine, creating an unpleasant odor at the facility. Martina Bugri has more in this report.
From the entrance of the hospital to the corridors of the various consulting rooms and the compound of the entire TTH looks as if the place has not been cleaned for ages. Stench from the drains laced with algae and maggot has taken over the hospital, making it difficult for patients and caregivers to breathe. There is filth eventually everywhere, with the environment in a total mess. Madam Aisha says her father has been on admission for 3 days and she's unable to step into the washroom. She says one can easily pick infections from these washrooms. The sanitation situation in the hospital is so terrible. Somebody can just go and urinate and pour her white down, and you will also go and urinate there and pick infections. When you look at the gutters, it's filled with maggot and flies. The whole place is in a terrible situation. What we are asking is that they come back just for our sake. We are pleading with them for God's sake, they should return back to work. Another caregiver says the entire place is a total mess. For patients, they would have to bear with it and so have to be cleaned instead of bathing.
Most Omania Bancana Durma, Cleaner Lama because the caretakers have all gone. Sometimes it is the women who sell things here that pick the rubbish on the compound. As for the washrooms, we can't talk about them. They are in a terrible shape and dirty. What we are doing now is to clean the patients. They can't use the washrooms to bath because of how bad the washrooms are. Ama barnamba na tala ba mimleso be ngun dundul ben to san kan shisha man ta pana mboala ma fune ama tan bargul ma to surkom to ko to sukom.
Earlier in the day, the public relations officer of the TTH, Mesbah Mohammed, had described the situation as total mess and a breakdown of activities at the facility. The patients and caregivers appealed to government to listen to the concerns raised by the health workers and address them to enable them return back to work. For Joy News, Martina Bugri reported.
And Martina joins us live right now. Martina, has the situation improved?
Nothing has changed at the TTH as we speak now. The garbage is still stuck there. The whole compound is totally in a mess. You know, from the beginning of the gate, as you walk in, it's littered right to the staircase and to the various wards and then the corridors of the consulting room. I must say that I was not allowed into the washrooms, but when you go through just the entire compound and the drainage system, you would realize that the whole place stinks so much that people who sit there to eat are just risking their lives. And if something is not done between today and probably tomorrow, I must say that the place would be a place that people would rather be picking infections from and not going to treat themselves. And the nurses are telling me that it's disturbing their work. They would have to stay at the hospital and work, but the situation is just something that they are unable to bear. And the patients themselves are complaining, but they have no choice. They are on admission, and so they have to take it that way. Their caregivers tell me that you just sit close to the drain, and when the sun hits, it comes up as if the whole place. And so they are just asking that government listen to them so that they can return back to work and then ensure that the place is clean. But my sources at the hospital tell me that nothing really will be done until government listens to their concern.
All right, so you'd want to think that the hospital management may probably want to find a way out of the situation by bringing on temporary people. Is that part of the plan?
Now, those who are supposed to be managing the hospital now, the administrators themselves are part of the strike. And so there's nobody to talk to. From office to office, I knocked. The entire building is locked. People are not moving in, people are not moving out. And so those who are supposed to actually lead the process themselves are not available.
All right, thank you very much, Martina Bogre. I've been trying to speak with the executives of the Health Service Workers Union, but they tell us they are in a meeting at the moment and so are not available to speak to the issue.